Good afternoon. My name is Hope Jernigan, and I am the Assistant Superintendent for Elementary Instruction, and I am here to present to you about returning to school healthy and safe. This is a mutual effort between the Department of Health here in Columbia County and Columbia County School District. Before I begin, I would like to give you a little bit of a disclaimer about the information that you will be presented with today. The information in this presentation is a mutual effort between Florida Department of Health and Columbia County Schools to assist parents and guardians in sending their children to school. Columbia County Schools will work to adhere to the guidelines set by the Florida Department of Health as much as possible. While adhering to quarantine guidelines, Columbia County Schools must also adhere to policies and procedures set forth by federal and state authorities. All employee absences will be considered on a case-by-case basis as the need arises. This information is not meant to be a substitute to proper health care. If you should have health questions or concerns, please consult your physician. As with anything regarding COVID-19, this information is subject to change. So, the mission of Columbia County Schools is that above all else, we are committed to the creation of a safe and understanding environment for all students and staff while providing a world-class education to all students. Then, with the mission of the Department of Health in Columbia County, we include that the mission of the Florida Department of Health is to protect, promote, and improve the health of all people in Florida through integrated state, county, and community efforts. So together, Columbia County Schools and the Department of Health are working to provide a safe and healthy learning environment for all students and staff members in Columbia County Schools. So at this time, we are going to introduce Mr. Adam Lipford, and he's an epidemiologist for the Florida Department of Health. He actually works with 6 counties, including Columbia County. So I'm going to turn it over to Adam at this time.
Hi, my name is Adam Lipford. I'm the regional epidemiologist for this area, including Columbia County. And today I want to cover some of the basics of COVID-19 just so that you are informed on the ways that it spreads, how it presents with symptoms, and some of the basic ways that we can prevent the spread of it as we move forward with, kids returning to school and some of the new phases of this pandemic. So getting into some of the basics, COVID-19 was first seen in Wuhan City in Hubei province in China, and it was initially linked to cases within a seafood and live animal market. Since then, we've seen it spread to almost every country in the world, and it's linked to person-to-person transmission. As of July 16th, there's been over 3.5 million cases reported in the United States, with over 300,000 in the state of Florida, and over 1,000 cases reported in Columbia County. So COVID-19 is a coronavirus, which is a family of viruses, and some of those do regularly circulate within humans and generally cause mild illness like the common cold. However, COVID-19 is not the same as these other coronaviruses. So if you're diagnosed with one of the others listed that regularly do circulate, that is not the same as a diagnosis with COVID-19. So getting into transmission and symptoms, it most often spreads from person to person, and this is through the larger respiratory droplets that are released from someone when they cough, sneeze, or talk. And these droplets then can land in the mouth or nose of someone who's in close contact with them, or can be breathed in by that person to infect them. And it's important to note that it can also spread from people who don't have symptoms. And our guidance on the 6 feet, the reason why we say that is because these larger respiratory droplets that come out of someone's mouth and nose when they're coughing, sneezing, or speaking, generally fall to the floor within 6 feet. So they only generally travel about that far. So that's why we get that guidance of staying 6 feet away so that you are lowering your risk of coming into contact with those infectious particles. It's also important to note that it can survive for a short period of time on surfaces. So it is possible to become infected by touching a contaminated surface and then touching your eyes, nose, or mouth. Those are the primary ways, your eyes, nose, and mouth, that the virus enters your body and also leaves your body. So it's important to refrain from touching those areas, but we'll get into prevention in the coming slides. As far as symptoms, they can appear 2 to 14 days after you've been exposed to the virus. And the slide includes the general ones and the most common ones, but it is not all-inclusive. Someone could experience symptoms not included on here. But the ones that, especially the school will be evaluating for and looking for, and generally what we see are cough, a fever of 100 degrees or more and chills, congestion or runny nose, fatigue, loss of sense of smell or taste, nausea and vomiting, sore throat, shortness of breath, muscle or body aches, headache, and diarrhea. And for the majority of people, it can present similarly to the flu. Most people do not have serious illness. It is a smaller proportion that do have serious complications from it. Children do seem to have similar symptoms to adults and generally have mild illness. Based on available evidence, most children do not appear to be at higher risk than adults, and while some children and infants have become sick with COVID-19, adults still make up the vast majority of cases that have been reported today. So for isolation and quarantine, to protect the safety and health of students and staff, school officials will send home or deny entry any student, visitor, or staff member with any symptoms of COVID-19. So most people are infectious with COVID-19 from the 2 days before their symptoms start to the 10 days after. And so we ask people to isolate or separate themselves from people who are not infected during that period to prevent the spread. And that includes staying home, staying away from others, even within their home, staying in a separate room, using a separate bathroom if possible, not sharing utensils, towels, cups. If they do need to go about the house and be around other members, they're wearing masks, frequently disinfecting, frequently touch surfaces. And if you do need medical care, that you call the doctor beforehand, but make sure to get medical care if you're experiencing shortness of breath or any other emergency warning signs, or if you think you're having an emergency. For quarantine, this would be for anyone who comes in contact with an infected person who is spreading the virus. So, like I said earlier, it can take between 2 to 14 days after being exposed to the virus before someone gets sick. And so we ask those who have had close contact with an infectious person to stay quarantined for 14 days. That is because they could develop illness anytime within that 14 days. And I'm going to give a couple scenarios to help explain this further and clarify this. But it's important to note that even if you test negative during this 14 days, that it's important that they stay home and quarantined for the entire 14 days. Because they could develop illness after that point that they were tested negative within that 14 days. So on this first slide, this is the quarantine timeline for no continued contact. So this would be if someone had close contact with someone who is infectious with COVID-19, but then that person was successfully isolated and they had no future contact with them. So in this example, if your last date of close contact was on the 1st, then you would be quarantined from the 1st to the 15th, and then that's when your quarantine would be lifted, assuming you did not develop illness yourself. In the next scenario, this would be continued contact. So this would be if, say, the person who is infectious was maybe a home contact that you're not able to isolate from yourself, and so you have continued contact with them every day. And so in this scenario, their symptoms start on the 30th. Well, we have to assume that you could potentially have become infected all the way through those next 10 days while they were infectious. And so then you'd be quarantined through those days and from the 9th to the 23rd, those 14 days, because you could have been infected on day 10, and then it could be another 14 days before you develop illness. And so this is assuming that there was no isolation done between those two people. So if you are experiencing symptoms of COVID-19, we ask that you contact the local health department or your medical provider to try and get tested if possible, so that we can determine if your illness is caused by COVID-19. And then of course, staying home till you're fever-free for 3 days, till your respiratory symptoms and other symptoms have improved, and until it's been at least 10 days since the symptoms have started. And of course, also siblings and other household members who have close contact should stay home for 14 days as well. So if someone is diagnosed with COVID-19 without laboratory testing, they weren't tested, but they were just diagnosed with it, we do ask that they call the health department or their medical provider again to, confirm that they do have COVID-19, and in the meantime, staying home until they are fever-free for 3 days, till their respiratory and other symptoms have begun to improve, and it's been at least 10 days since their symptoms started. And again, symptoms and household members should stay home for 14 days. Now, if there is an alternative diagnosis, if they test negative for COVID-19, but they test positive for, say, norovirus or hand, foot, and mouth disease, then we'd follow the provider directions and treatment and return guidance for those illnesses. Now, if you've received a laboratory test for COVID-19 and are positive, you'll be contacted by the local health department with instructions on, when it would be safe for them and their household contacts to return to school or work. And if negative, again, it is still important that they stay isolated for the 3 days of till they're fever-free for 3 days, until their respiratory and other symptoms have improved, until 10 days from the onset of symptoms, just because, like I said previously, if they've had contact with someone, they still could test positive within those 14 days. As far as prevention, some of the very simple ways that we can prevent the spread of this is, number one, washing hands with soap and water properly. So there are ways that you can wash your hands that are not as effective. So it's important that when you're washing your hands, to make it most effective, first, wet your hands with the water, then pump the soap, scrub all surfaces, including in between the fingers, palms of your hands, your fingertips, your thumbs, for 20 seconds, and then rinsing. If soap and water are not available, you can't use it, then hand sanitizer with at least 60% alcohol is effective at killing COVID-19. And then, again, avoiding touching your eyes, nose, or mouth, because those are the main ways that the virus enters and leaves your body. So that can help prevent you from getting sick and from infecting other people, avoiding close contact with sick people, and of course, if you are sick, staying home. Another important way to prevent the spread of this is wearing a cloth face covering. Now, I was asked to specify that students should wear a solid colored or school logo face covering, and that surgical masks are not necessary. So to properly wear a face covering that it's effective at preventing the spread, it needs to cover the mouth and the nose. I know I've seen some people wear them where they only cover their mouth, but if you remember, one of the main places that the virus enters and leaves a person's body through also includes their nose. So if you're not covering your nose as well, then the face mask is not as effective at preventing the spread. So it's important that you cover your mouth and your nose, that you tie it behind your head or use the ear loop so that it's securely snug against your face, and also that you don't touch your mask while wearing it. I know this is sometimes hard, but when you're wearing it, it's supposed to be preventing the spread of the virus, so we should assume that the mask is dirty. So if you do touch it, you should wash your hands or use hand sanitizer after touching it. If when you go to remove it, touching it from either the ear loops or untying it from the back and not touching the front of it. And again, washing your hands again or sanitizing it once you remove the mask. And regularly wash your mask with soap and water in the washing machine. For more information, you can visit floridahealthcovid19.gov, or you can visit the CDC's COVID-19 website.
All right, so thank you, Mr. Lipford, for your work. At this time, I'm going to turn it over to Miss Judy Tatum, and she's our Director for Safe Schools. And a part of her work, not just safety, including mental health, but also working with the schools for a safe and healthy return during this COVID-19 pandemic. So at this time, I'm going to turn it over to Miss Judy Tatum.
With the ever-changing landscapes of our lives as you cope with COVID-19 outbreak, we are all trying to determine what is the best options for your family. Your children, your teens, they may be worrying about the safety of your family, struggling with thoughts and feelings about the stories and the images that are coming from the coverage of COVID-19, and the uncertainty of not knowing when they can return to those normal routines that provide them comfort. They may turn to other trusted adults for support as well. They might look for guidance to you. We hope that the resources that we're going to talk about will just give you some options to help with this time of uncertainty, and will help provide a little bit less of a stressful situation. First of all, we'd like to start the conversation with your child. Just talk to your child, encourage your child to ask questions, answer to the best of your ability. If you don't know, be honest with your child. Tell them that it's okay that they don't know, that they're feeling anxious, that they're feeling worried, but that you're there for them and you're going to help support them. And to the best of both of your abilities, you'll be able to work through this together. Also, validate their emotions. Let them know it's okay, that you may be feeling the same things. But again, being there for your child and just opening up that conversation with them will help them provide a less stressful situation. Limit their exposure and your exposure to the media. Only watch and listen to those sites that you feel are or can be trusted. That's what we need to make sure, that we're not exposing our children and ourselves to things that we don't know are facts or true. Also, provide reassurance that we'll get through this together, we're working on a solution, and that as a parent or a guardian, you are going to provide the best solutions that you can possibly do with your child's input. Practice self-care. Get up, let them do breakfast and lunch and dinner, and just establish that routine. Take showers and just be clean. That's what will help as well. Be a positive role model. Look for your actions and determine, am I being a positive role model? Because our children are watching us. They're watching us to see how we are responding to this situation as well. Reestablish our daily routines. As school's starting to approach and we're talking about going back, maybe now is the best time to start working on bedtimes again, establishing a normal breakfast routine, a normal lunch routine, and get your child back into a rhythm that could also help to provide some stability in their lives. And finally, just enjoy spending time with your child. You have a few more weeks left before school starts and the routine gets going again. And so I just encourage you, go out, take a nature walk, read a book together, watch a cute movie together. Do something that will show your child that spending time with them and getting to know them even better in these situations is what is the most important for you. And finally, if you see some activities in your child, some depression, sleeping late, some things that just aren't really their normal behavior, you may want to reach out to your child's pediatrician or doctor. Tell them what's going on. Also, you can reach out to your school counselor, explain to them what's happening, and they can provide some resources for you as well. And then you'll see on the screen a phone number to the Columbia County Safe Schools office. We as well can provide you with some support and some direction if you give us a call, and that number is 386-755-8192. I hope these suggestions are helpful, and I hope that you can apply them easily in your life, and the stress will soon be eliminated from your lives, and we can get back to a normal routine. Thank you.
All right, thank you, Judy. So I'm going to go into some information right now talking about preventing the spread, starting off with the clean environment. When we are clean, we can stay healthy for a longer period of time. So that's a lot of what you're going to hear next. Some of the things that we're doing in Columbia County Schools include making sure that we have good new classroom arrangements that allow for greater social distancing. Teachers are already working on this, and they are removing furniture as needed so that students are as far as 6 feet apart as much as they possibly can be. In secondary schools, we are also using block scheduling so that we have fewer transitions in a day where there's lots of kids in hallways, and as well as having smaller numbers because of those block schedules. So those things are already being implemented. We are also in the process of acquiring CDC and EPA approved cleaning products so that our campuses are nice and clean, and we ensure that the products we are using are able to kill viruses and bacteria as much as possible. The cleaning equipment that we are using also will help improve the amount of time that we spend in cleaning and make sure that we're getting the job done well. So we have also acquired new equipment in that area. On the cleaning note, our custodial staff has gone through a training on July 15th to be exact. We had a training with our custodial staff for the whole district. They reviewed the supplies that we're going to be using, the new cleaning equipment, and some very strict procedures and protocols for cleaning on different schedules. There are new schedules that principals are creating for each school campus, and each school board facility also has the same protocols in place. In addition to cleaning our school environments, we also have to make sure that we have clean transportation environments as well. Transportation services employees will be trained in cleaning protocols specifically for school buses. Buses will be cleaned between each route. All bus riders are strongly encouraged to wear face masks or shields while riding the school bus. And parents are also strongly encouraged to transport their children to and from school so that we can reduce the number of students on each school bus. At this time, I'm going to turn the presentation over to Ms. Kim Allison, and she is our district's head nurse.
Healthy hand washing, sneezing, and coughing strategies will be taught. Posters and signs explaining the proper steps will be displayed on each campus. Teachers will teach students how to physically distance in classrooms and hallways. All employees will be trained to recognize signs of illness in other individuals so that they can get help to them if needed. All individuals on campus will have access to soap and hand sanitizer. Do your part. Stay home if you're sick. If you have a fever, please do not take fever reducers, then come to work or school. Please wear face masks or shields when in close proximity to others for prolonged periods of time. Substitute teachers and vendors will be held to the same health safety protocols and standards as the rest of Columbia County School employees. To limit students and employees to possible exposure, we're moving to a closed campus status where no visitors will go past the front office.
Thank you, Miss Allison. All right, so in addition to our healthy habits, I have some more information to share for you that goes into what's going to happen in a school day. So our lunch schedules have been adjusted so that students can be seated with greater distance, and we are able to keep lower numbers of students in the cafeteria at one time. So your child's lunch schedule may look a little different than it did last year, and we are just trying to do our best to keep those numbers low. On the first day of school only, and this is very, very important information, on the very first day of school only, students in VPK or kindergarten may be walked to class by their parent as long as parents are wearing a face mask or a face shield. Again, on the first day of school only, parents of children who are in VPK and kindergarten are able to walk their kiddos to class as long as they are wearing a face mask or shield. So here's some important information as well that is the one piece of information that I think everybody's waiting to hear. What's going to happen if someone comes down with COVID-19 and they have been present at school? What are we going to do? So here's how it works. If someone presents COVID-19 symptoms, we will follow the Florida Department of Health decision tree for symptomatic people in schools and child care programs. That documentation was just released last week, so that would be about July 13th or 14th. We are following those protocols as closely as we possibly can. As I said at the beginning, each situation is a case-by-case decision. We will look at the decision tree provided by the Department of Health, and we will be in contact with the individual as much as we can so that we make sure that we do what's right for that current situation. Those in close contact with an individual who is symptomatic or shows a positive test will be notified of the incident, receive specific steps to follow from the Department of Health, and their symptoms will be monitored. So here's the next piece of information that everyone wants to know. When can someone come back to work if they've been sick or tested positive for COVID-19? Here's the guidelines. If you are fever-free for 3 days and you show improvement of your symptoms and 10 days have passed since the symptoms first appeared, then you can come back to work. What we are asking for each individual to do is if you have been sick or tested positive and you have met those 3 categories, call your school nurse. Or if you are a district employee, you will need to call your supervisor and Kim Allison, and we will walk through this with you. So you might be asking, well, what if I was just exposed? Who else needs to stay home? Anyone who has been in close contact with someone who has had symptoms for COVID-19 should stay home for 14 days, monitor symptoms, and consult with the health department. Close contact, let's define that. Close contact means that you've been within 6 feet for at least 10 minutes. So if you're just passing by someone, that might not qualify for close contact. But if you've been in a meeting in a small classroom, or if you've been in an office space and you've been in that area for more than 10 minutes and you've been closer than 6 feet, then we would need to evaluate that as a need to quarantine. So, I know that you've heard a lot of information in this presentation, and you might want to go back and review it. If that is the case, please feel free to go to our website and you will be able to find the presentation at that location. The website is www.columbia.k12.fl.us. If you are a school district employee, please feel free to contact your supervisor for more information. If you have any questions, you will be able to find answers throughout the coming days. As I said at the beginning, some of this may change, and as things change, we will update everyone as soon as we can. Thank you. I hope that everyone's being very cautious, and by taking precautions and staying informed, we will have a successful year. Thank you.